So my poster explores how orthodontic treatment contributes to the management of Naegeli syndrome, a rare craniofacial condition, and highlights the clinical strategies, outcomes, and challenges associated with long-term care. Naegeli syndrome is a rare genetic disorder caused by abnormal development of the first and second brachial arches. It's most commonly associated with mutations in the SF3B4 gene and presents with significant craniofacial abnormalities, including mandibular hypoplasia, cleft palate, and facial asymmetry. These features often lead to airway obstruction, feeding difficulties, and dental complications. And because of these challenges, orthodontic care plays a critical role in both function rehabilitation and aesthetic improvement. The purpose of this review is to evaluate how orthodontic interventions impact patient outcomes and to emphasize the importance of multidisciplinary management. So some of the objectives of this literature review are to examine orthodontic and surgical treatment approaches used in patients with Naegeli syndrome, to evaluate reported functional and dental outcomes, and to identify ongoing challenges such as relapse and long-term stability. Additionally, this review aims to highlight gaps in the literature and the importance of interdisciplinary care. A systematic search of PubMed database was conducted using keywords related to Naegeli syndrome, orthodontic treatment, and mandibular hypoplasia. Only English language articles that included orthodontic interventions or clinical outcomes were selected. These studies were grouped into thematic categories including early intervention, combined surgical and orthodontic treatment, and long-term follow-up, allowing for a focused analysis of treatment strategies and outcomes. So, clinical manifestations and challenges. Patients with Naegeli syndrome exhibited a wide range of craniofacial abnormalities, most notably severe mandibular hypoplasia, trismus, and cleft palate. These anomalies frequently result in airway obstruction, feeding and speech difficulties, and compromised oral hygiene. The severity of these manifestations varies greatly, requiring individualized treatment plans and early intervention to prevent life-threatening complications, particularly in infancy. Orthodontic treatment, orthodontic techniques and outcomes. Orthodontic treatment is typically integrated with surgical interventions. One of the most common approaches is mandibular distraction osteogenesis, which lengthens the jaw and improves airway function. While this technique significantly enhances facial symmetry and breathing, relapse is a common concern, especially in growing patients. In more severe cases, genioplasty distraction combined with hyoid advancement is used to further improve airway patency. Orthodontic appliances are essential both before and after surgery to align the dentition, stabilize skeletal corrections, and optimize function outcomes. So the stages of intervention. Treatment is typically delivered in stages. In the neonatal phase, the primary focus is airway management and feeding support. During early childhood, distraction osteogenesis and orthodontic preparations are initiated to guide skeletal growth. In adolescence, definitive orthodontic treatment is performed to correct occlusion and address residual skeletal discrepancies. And this stage approach allows treatment to align with the patient's growth and developmental needs. So despite advancements in treatment, several challenges remain. High relapse rates following mandibular distraction are common, particularly during growth spurts. Limited jaw mobility complicates oral hygiene and increases the risk of dental disease. Additionally, the prolonged nature of treatment and visible craniofacial differences can have significant psychosocial impacts. These challenges highlight the need for long-term follow-up and comprehensive patient-centered care. This review demonstrates that orthodontic care plays a vital role in improving function, airway stability, and facial aesthetics in patients with Naegeli syndrome. However, long-term stability remains a challenge. Emerging technologies such as 3D imaging and virtual treatment planning show promise in improving treatment precision, and multidisciplinary collaboration among orthodontists, surgeons, speech therapists, and other specialists is essential for addressing the complex needs for these patients. In conclusion, orthodontic treatment is a cornerstone of care for individuals with Naegeli syndrome. While techniques such as distraction osteogenesis have significantly improved patient outcomes, challenges related to relapse and long-term management persist. Continued research, technological innovation, and and interdisciplinary collaboration are necessary to improve quality of life and treatment success for this rare patient population.